So I'm Brent Hallmark. I'm a nurse practitioner with the fellowship program at the medical center, and today I'm going to try to lead a conversation about type 2 diabetes. We want to today we want to kind of learn just a little bit more about that. We've concentrated on prevention and set everybody up with a lot of tools to help with that. So I wanted just to briefly review over what we've done. I think we only have a few more classes left, but now would be a good time just to look back. And so if everybody can see my screen, these are kind of the highlights of everything. You can see our activity and tracking our food, how to cook, managing stress, finding time for the fitness, coping triggers, taking charge of your thoughts, and getting support. And I realize sometimes that some people have a easier time with one of these things than they do another. I know it's challenging for some people uh, in different areas, and it may not be a challenge for others in the same area. So I wanted to kind of ask the group to think, and maybe we could get a few volunteers to talk just a little bit about what so far what has been the most challenging thing. Has it been fitness, food, stress, just what has been your challenges?
Hey, it's Rebecca. Just from my perspective, it's always going to be food. I'm a stressed food eater. I eat whatever it takes to get through whatever is happening. So, probably for me to do best in food, I would almost need to be in a very unstressful, controlled environment, which sometimes doesn't happen often.
Sure. And anybody else have anything?
For me, it's been the activity, just making sure I get the 150 minutes, but it's also held me accountable to get it each week.
This is Dr. Rayford. It's similar to Rebecca. It's been the food, but a little different from. It's lately been the challenge has actually been consistency in terms of just kind of maintaining some moderate intake, and it's kind of boom or bust kind of eating that is compounded by high exercise levels. And one thing I think I may have said, you can't out exercise nutrition. And so it's kind of worth knowing and preparing for. And that's the thing that has been more of a struggle now and over the last few years have been consistency in terms of not having so many. I mean, now I'm consistently, my weekend eating is very different from my weekday eating, and trying to move those closer together, not making my week more extravagant, but making my weekend eating less extravagant.
Yeah, that's a good point. We'll find out a little later that consistency is pretty important with both prevention and treating type 2 diabetes. Um, so now's a good time just to kind of be mindful of your challenges. And so like I said, we only have just a few more meetings left, so we can kind of see the end of this. But we want to wrap everything together very well by talking about more what is type 2 diabetes, how do you treat it, how do we diagnose it, and if you'll see here, the complications of diabetes affects your whole body. It can cause the endothelial inflammation in your vessels. It can cause problems with your heart, kidneys, eyes. That's why we have constant check for to look at your eyes and make sure that we don't have any complications, those microvascular complications going on. So this picture is just a little outline of what all it really affects in your body, and it's very widespread as what it can do to you. So as you'll see here, some of the risk factors for type 2 diabetes. I'm sure we've covered a few of these in the classes, but just being a little heavy, overweight, sedentary, not getting up, being active as you can. The parent or sibling with type 2 diabetes is important because we do see that there's sometimes a hereditary component to this. If you'll look at your ethnicity, some people have or have a greater propensity to be affected by this, and your age, and if you'll look here, the having diabetes while pregnant, that can be an indicator too. This is just another picture that I had, just presented some of it in a different way, but shows you some of these indications that you may be more at risk, and the importance of knowing whether or not you're more at risk is so that you can be more mindful of it. We'll look in a presentation just a minute that being mindful of different risk factors can be beneficial with monitoring and some lifestyle changes. So, do we have any questions so far? If we have any questions or comments, just let me know. So we've been over what diabetes can affect in your body. We've been over some of the risk factors, but now how do we diagnose diabetes? We have the hemoglobin A1C, which is more of a long-term average of your blood sugar. Gives you an indication of how you've been doing over the past 3 months, and then you have the fasting glucose over here. So we'll say the normal is below 5.7 on the A1C, and then we go over to pre-diabetes, and then diabetes is over 6.5. So in the office, when we get our labs drawn, this can be how we can diagnose diabetes with our patients. So after a diagnosis has made, it's important just to be very, very aggressive with managing this, and it sounds simple, but it's really about keeping those blood sugars at a low, consistent level. And that's why I said we would see the issue with consistency later on, because really our goal is to get that lower blood sugar level very, very consistent throughout the day without big spikes, and that has the best control over diabetes. And you see our sugars and our carbohydrates. Like Dr. Rayford said, exercise can't undo the eating, so we watch out for these two things. But physical activity is also important, and with these lifestyle interventions, plus some of the medications, we can get some good control over diabetes. So here's some other things right here that you would look at, just how to monitor yourself at home. I said we want a good consistent blood sugar level, so we do that by self-monitoring. There's different types of monitors. Some are a little more involved than others. And it just depends on how often that you need to check that throughout the day. So if I could get somebody to read this, this is Mike and Henry's story, and I think it's a pretty good illustration of you know, a lot of people that we would meet in public with concerns about type 2 diabetes, or people that already have it. So if somebody will mind reading that.
I'll probably okay. What I'll do is I'll kind of summarize and highlight it.
Yeah,
I'll summarize and highlight it. So you got two folks. Mike is the son. Henry is the dad. Mike has pre-diabetes. Henry has diabetes, type 2 diabetes. And so what this does is it goes through and it illustrates kind of their life. That so Mike is trying to prevent having type 2 diabetes because he's obviously at risk because of definitely his family history. And then Henry has it. And so it talks about how both watch what they eat, both exercise, both have been advised to lose weight. Henry, because he has type 2 diabetes, he has to take medications and test his blood sugar. And the summary is kind of there's different things that Henry will need that Mike doesn't need because Henry has type 2 diabetes. And so some of those things, routine blood checks, more routine doctor's visits, eye exams, foot exams, kidney evaluations, and actually the need for more medications than just blood sugar medications for type 2 diabetes. And then toward the end, it says that, you know, both have engaged in lifestyle changes and, you know, have controlled blood sugar. Henry has controlled blood sugars for a diagnosis of diabetes, and Mike is, you know, sugar has got normal, and he's preventing his risk of progressing to diabetes. But just kind of highlighting so some people may say, well, if I'm advised to lose weight and I'm exercising and I am monitoring my nutrition, isn't that what I'll be doing if I have type 2 diabetes? And the answer is yes. You can do that to control your diabetes, and even get to a point, and it's not mentioned in this topic, but get to a point where you're not on any medication. But it just kind of highlights that the lifestyle changes can be important to regulate the sugars, and it is an important distinction of pre-diabetes, and so you have less things that you have to do versus type 2 diabetes. So it kind of gives more reasons to prevent type 2 diabetes if you're able.
Exactly. That's a good summary and a good point at the end. The lifestyle changes needed for prevention and treatment are very, very similar, but things do get more complicated once you have that diagnosis made. It's a more very close monitoring and just really trying to keep a good eye on everything. Of course, we see there is a hereditary aspect sometimes. Not that things are not preventable, but sometimes you just have to be a little bit more mindful of that when you're working on prevention. So, so just thinking about this story, I want everybody just to kind of think and just think and maybe comment if you wouldn't mind. How would your life change if you had type 2 diabetes? How does that make? How would that make you feel if you got that diagnosis for type 2 diabetes?
Dr. Rayford, I know. Oh, I can hear.
So for a lot of people that we see in clinic being diagnosed, it's some people are surprised, some people aren't, but it's generally a confusing time and even just a little bit of a scary time for some people. Because of all those complications that can come about, very serious complications. But the silver lining in all this is that we can get very good control of diabetes, and we can control a lot of these complications, and we can affect our outcomes with this. So it's not just a dead set diagnosis and end to everything. It's something that we can control. But if we think about how we might control it, that would bring us to the next question. What will you do to prevent it if you don't already have it? So it's some good things to think about. Any questions or comments?
Brent, I feel like if I were diagnosed with type 2 diabetes, or if, my doctor told me that I was pre-diabetic, I feel like I would feel really restricted. Because, of course, if you're not in the medical field, or even if you are, diabetes is kind of a word where we always grew up, especially in the South, of, when someone has diabetes, they have diabetes and they have to live with it. So for those, people who don't know, it is preventable, and it's not like your life is over. There are multiple things that we can do to prevent it and reverse it. But I feel like if I was non-medical and someone told me that I had diabetes, my life would kind of just stop, because I do love eating sweets and things like that, and I wouldn't necessarily have to cut that out. I would just have to learn to work around it in modification.
Yeah, so that's a really good point, and it's more the fear of the unknown. We're setting our routine, and so what is next? How is this really going to affect my life and lifestyle? So that's a really good point. Anybody else having comments or questions?
I think if someone had a family member have a serious complication that they were involved with, especially if they were young and a grandparent had to do dialysis, or maybe someone had to have an amputation or something, I've had patients through the years to some degree feel that it was almost inevitable, it was going to happen, that it would happen to them sometimes, or especially to me, if they started at a young age, they would have that worry of, it's happened in our family.
Yeah, that's a good point, and we never need anybody to feel like there's nothing they can do about it, because there's always a way to improve your situation, no matter where you're at. So just getting that control and getting some help, and that's another reason why I kind of listed some of the things at the front, is kind of identifying what's your hardest aspect to prevention, or to treatment if you've already been diagnosed with that, is what's going to be the hardest thing, and getting support. Some people have some people have things in their life, depression, life events, things that they need to conquer before they can start work on physical activity or food. But it's just wherever you're at in your life, it's nice just to know where you're at so that you know where to start. So that leads me. To this. What's next? Prevention and managing type 2. It requires a well-rounded approach. Mind, body, spirit, everything. If you're not feeling your best, you're not going to want to get out and exercise and come up with meal plans. And some people may need more support from everybody. And using the tools that we are teaching here, that is very important. Like I said, identifying what your challenge is going to be, and then we'll see here next, making your plan and always getting the support you need. That's very, very very important. So I think if you follow the program, you've seen the action plan log. If you're following through with this program, make a new action plan this session. And I think I've heard Dr. Rayford say this before, and it kind of falls in line with identifying what your weaknesses are, identifying where you're at in life, but try to make a plan that challenges you, but also try to make a plan that is reasonable for you at whatever point you're at in life. So that's very important, to be challenged, but for it to be realistic as well. So does anybody have any questions or comments?
One thing I just always try to remind folks as far as the activity, we now have the website set up. Deborah Pugh just emailed this week and is getting it out on the Facebook and our North Mississippi website. Our Walk with a Doc events each month will now be virtual for anybody who wants to log in, much like they logged in tonight. It will be a website. You click on the day. You can hear the presentation at the beginning. Nicole Taylor presents this month on the last Friday. But weather being as it is and too hot or too cold, this will let anybody anywhere with their iPhone or a laptop in their home or at work or their walking track be able to walk, at least that day and hear a presentation, but then hopefully every day be inspired to get into as much activity. So just trying to make things flexible for people with their work schedules and their life schedules. So as we all go to clinical or in our work, we can share with everybody the website or if they're asking about anything that can help with diabetes prevention, this class or the walk, that's now up and on the website and on the Facebook page.
Okay, good point. Thank you. That's all I have on the slides. If anybody has any questions, comments, please let me know. But I've enjoyed it this evening.
I want to remind folks that if you're following weekly, you can still submit your weights and your exercise minutes every week, but at least every session.
That's right. You can just email it to that diabetes prevention email that we have, or let Angel or me know. She's recording them, and so we will know everybody's kind of status as they go through. I'm sure everybody's tracking for themselves, but we can let you know. And let's say I see something in the chat that Courtney says, "Thank you, Brent," and you definitely did a good job sharing knowledge with us this week, so we appreciate it. We got you done in time for a walk. The rain's quit in Smithville, so maybe it's pretty and cooler where you are. You can get a few steps in this evening.